Hi everyone, welcome back to my YouTube channel. Today I will be talking about CLIA Competency Assessment. For those who do not know what CLIA is the Clinical Laboratory Improvement Amendments of 1988 regulations, which include federal standards applicable to all U.S. facilities or sites that test human specimens for health assessment or to diagnose, prevent, or treat disease. Competency is the ability of personnel to apply their skill, knowledge, and experience to perform their laboratory duties correctly. Competency assessment is used to ensure that the laboratory personnel are fulfilling their duties as required by federal regulation. The following 6 procedures are the minimal regulatory requirements for assessment of competency for all personnel performing laboratory testing. First on the list is direct observations of routine patient test performance, including patient preparation, if applicable, specimen handling, processing, and testing. Monitoring the recording and reporting of test results. Review of intermediate test results or worksheets, quality control records, proficiency testing results, and preventive maintenance records. Direct observations of performance of instrument maintenance and function checks. Assessment of test performance through testing previously analyzed specimens, internal blind testing samples, or external proficiency testing samples, and assessment of problem-solving skills. Competency assessment, which includes the 6 procedures, must be performed for testing personnel for each test that the individual is approved by the laboratory director to perform. Documented competency assessment is required for individuals fulfilling the following personnel responsibilities outlined in Subpart M of the CLIA regulations: clinical consultant or CC, technical consultant or TC, technical supervisor or TS, general supervisor or GS, and testing personnel or TP. Clinical consultants, technical supervisors, and general supervisors who perform testing on patient specimens are required to have the 6 required procedures in their competency assessment, in addition to a competency assessment based on their federal regulatory responsibilities. Note, if laboratory director or LD is the only individual testing and reporting test results, they must establish and document a minimal level of proficiency in order to ensure that they maintain the required competency for accurate and reliable testing and reporting. Who is responsible for performing the competency assessment? The technical consultant for moderate complexity testing, which is in Title 42 Code of Federal Regulation, Part 493, Section 1413B8, is responsible for performing and documenting competency assessments. The competency assessments may also be performed by other personnel who meet the regulatory qualification requirements for TC for moderate complexity testing. The technical supervisor for high complexity testing is responsible for performing and documenting competency assessments. This responsibility can be delegated in writing to a general supervisor as long as the general supervisor meets the regulatory qualifications as a general supervisor for high complexity testing. Peer testing personnel who do not meet the regulatory qualifications of a technical consultant, technical supervisor, or general supervisor cannot be designated to perform competency assessments. Ultimately, the laboratory director is responsible to ensure that all testing personnel are competent and maintain their competency in order to perform and report accurate and reliable test results. How often should competency assessment be performed? Evaluating and documenting competency of personnel responsible for testing is required at least semi-annually during the first year the individual tests patient specimens. Thereafter, competency assessment must be performed at least annually. Competency assessment can be done throughout the entire year by coordinating it with routine practices and procedures to minimize impact on workload. Note, if test methodology or instrumentation changes, an individual's competency must be re-evaluated to include the use of the new test methodology or instrumentation prior to reporting patient test results. Now I will go over some of the frequently asked questions. Do I need to assess all 6 procedures of competency? The answer is yes. All 6 procedures must be addressed for personnel performing testing for all tests performed. However, the competency assessment can be done throughout the entire year by coordinating it with routine practices and procedures to minimize impact on workload. If my laboratory performs high complexity testing, do the requirements for competency assessment testing personnel differ from those of moderate complexity testing? The answer is no. The 6 required procedures for assessing testing personnel competency assessment are the same for both moderate and high complexity testing. If my laboratory only performs wave testing, do I need written policies for assessing personnel competency? CLIA does not require policies for assessing personnel competency for wave testing. Even though CLIA has no specific requirements for personnel performing wave testing, you need to ensure that patient testing results are correct to assist in making an accurate patient diagnosis. You will need to ensure that testing personnel are following all manufacturer's instructions. Testing personnel who are properly trained and performing the test correctly will aid the physician/provider in making an accurate patient diagnosis. If your laboratory is accredited, you may need to consult your accrediting organization standards. Do all 6 procedures of competency assessment need to be performed at the same time each year? The answer is no. Competency assessment can be done throughout the entire year. The laboratory may coordinate the competency assessment with its routine practices and procedures to minimize impact on workload. May I use proficiency testing or PT performance to assess competency? Yes. Proficiency testing performance may be used as part of your competency assessment. However, use of PT performance alone is not sufficient to meet all 6 required procedures. I have personnel in my laboratory that only draw blood and label samples. Does CLIA require that I perform competency assessments on them? What if the phlebotomist perform bleeding times? No, competency assessment is not required by CLIA for non-testing personnel, examples, phlebotomist, accessioning personnel, etc. However, this would be considered good laboratory practice and a good quality assurance measure. Yes, if the phlebotomist or other non-testing personnel perform bleeding times, then they will require competency assessment, as a bleeding time is a moderate complexity test. Is competency assessment the same as proficiency testing? No, under CLIA, competency assessment is not the same as proficiency testing. Competency assessment is used to confirm that laboratory personnel are adequately performing their laboratory duties. Proficiency testing or PT assesses the laboratory's ability to perform accurate and reliable testing by the testing of unknown samples sent to a laboratory by a CMS-approved PT program. Hope you found this information useful. If you enjoyed watching this video, please consider subscribing to my channel and leave me a few comments. Thank you for watching. Bye now.